Hello, my name is Dr. Ahmed Hankir and this is
Dr Haitham Alhamwi,
and we will be co-hosting the workshop entitled Underground Health Networks in Syria. So firstly what I'll do is I'll just read out to you the actual abstract of the workshop, which is as follows. So more than 5,000 innocent civilians have perished as a result of the Syrian regime's crackdown on rebels and revolutionaries, and the number of deaths is continuing to rise at a staggering rate. There have been alarming reports that non-governmental organizations and humanitarian agencies have been denied access to the most beleaguered parts of Syria, namely the major Syrian cities of Homs and Hama. Dr. Haitham is of Syrian descent, and I am of Lebanese descent, and we both have first-hand experience of conflict. And what I mean by that is that we've been touched by this recent wave, if you like, of conflict in the Middle East. In this workshop we will be presenting reports about the underground networks that have been established in order to facilitate the covert provision of healthcare services to the victims of the uprising in Syria. And so without further ado, the next segment will be hosted by my colleague and my friend Dr. Haitham.
Hello, my name is Haitham Alhamwi. I'm a medical doctor from Syria. I'm doing my PhD research here in the University of Manchester in occupational epidemiology. Firstly, I would like to thank you, Medicine, for giving us this opportunity to present, to host this workshop regarding the underground health establishment in Syria. And I would regret not being able to be with you in person due to unforeseen circumstances. My friend Dr. Ahmed Hankir will talk about the networks in detail, but I would like to talk about my personal experience with the conflict in Syria during the recent uprising and before that uprising as well. Before the recent uprising, which started in 2011, in 2003 a group of youth people, including me, tried to participate in developing our society in Syria by opening a free public library and making a few campaigns like anti-smoking campaign and cleaning campaign and anti-corruption campaign. Due to those social activities, the secret police, the Syrian secret police, arrested us and referred 11 of us to a secret-filled military court, which sentenced me and another friend for 4 years imprisonment and sentenced the rest of us for 3 years imprisonment. So during my being in prison there, I knew how they treat prisoners from many sides, and especially from the health aspects. I can say now I remember three stories. One relating the tuberculosis patients, people who has tuberculosis, and many of them should be hospitalized, but they never went to hospital. Sometimes they don't have the proper treatment, and they were not quarantined, and they spread the tuberculosis to other prisoners. And many of the prisoners should have emergency operations, but they never went to hospital as well. And due to the low quality, the poor quality of the food, many of the prisoners developed malnutrition. And I remember a case of a fellow who had vitamin A deficiency, and consequently he had impairment in his vision. I'll stop here now and I will move on to the recent uprising, which affects the Syrian people more. The Syrian people started their own quest for freedom in March 2011, and the Syrian regime reacted violently to their peaceful quest. And the Syrians participated in many peaceful protests in the streets, and the security forces of the Syrian regime shot them in the streets. Those injured people at the beginning went to public hospital and to private hospitals, but unfortunately the security forces arrested them from the hospitals, and sometimes they killed them inside the hospitals. Because of those incidents, people after that stopped going to the public hospitals, even to the private hospitals, and start building their own health facilities. My relatives participated in a few of those peaceful protests, especially at the beginning of this uprising in early 2011, and due to that they were detained. My father-in-law and my brother were imprisoned. My father was imprisoned twice, and he was tortured in both arrests. And he told me how the security forces deal with the people, and especially with the injured people. They have many people who are injured in their legs, in their arms, even sometimes in their abdomen, and they treat them as they are healthy. They beat them, although they are injured, they beat them. They never send them to the hospital, although they need to go to hospital urgently. And he told me in his last arrest that in his cell, one of his fellows went to the military. They took him to the military hospital because he was unconscious. And when he was unconscious when he reached the hospital, when he opened his eyes, they started beating him in the hospital until he became again unconscious. And he told my father that I was tortured there more than the amount I was tortured in the prison itself. Due to that, no prisoner will agree to go to any military hospital. One of the famous writers, he was with the same cell, in the same cell with my father. He had many health problems, and they offered him to take him to the military hospital, but he refused to go there because he knew that he will be tortured there more than being treated. This is one aspect of the problems. The other aspect that many of the doctors who treated injured people were imprisoned because they treated injured people. I had two friends who are doctors. They were the main charge was they treated the injured people, and that was obvious that they want. One of the security officers told my friend, "You are treating those who were shot because we want them to be dead." So. This is another aspect of the prohibition of health services. The last story I would like to mention is the story of my friend who was shot in a protest, and his family took him immediately to the public hospital. The security forces went to the public hospital. He was in the theater. They took him. He was unconscious in the theater. They took him from the bed from the theater and disappeared. Fortunately, the Arab monitors arrived my town the following day, and all people raised the issue of my friend and told them that he was taken from the theater, and they investigated the issue, and because of that they took him to a proper hospital, and they gave him medication. And but unfortunately he is still detained. I have received a report from physicians for human rights, and my fellow Dr. Hankir will summarize this report, which contains a lot of stories similar to what I mentioned now. Thank you for your time, and to Dr. Hankir.